And tonight's topic is CBD and endometriosis. I'm also one of the co founders of this amazing company. And more importantly, I forgot to tell you that I'm an obstetrician gynecologist. So, endometriosis is one of the disease entities that's very near and dear to my heart because I have so many patients that suffer from this very debilitating and chronic condition. So, what exactly is endometriosis? Well, endometriosis is a very, very painful disorder. It affects about 10% of women. And what happens is that the endometrial tissue that is lining the uterus or the womb here, this tissue is found outside of the uterus. And the way it finds itself outside of the uterus is that when a woman has a menstrual cycle, the blood should come out of the uterus and through the vagina. But what happens in endometriosis is that there is something called retrograde menstruation. That means the blood, instead of coming out of the vagina, it goes back up through the fallopian tubes here and implants on the ovary, it implants on the uterus, it implants on the uterosacral ligaments in the pelvis. It can even implant on the intestinal tract. When that happens, this tissue starts to grow. It causes severe pain. It causes severe swelling and inflammation. And it can also accumulate and develop cysts. This scar tissue and adhesions can cause long-term and debilitating chronic pain, pelvic pain, but it can also cause infertility, not allowing women to have children. So one of the primary symptoms of endometriosis is pelvic pain. It can be associated with the menstrual period. And it also can cause lower back and abdominal pain during those monthly periods. It can cause severe pain during intercourse. It can cause painful urination or bowel movements. It can cause intramenstrual bleeding or heavy menstrual bleeding. Again, it can cause an inability for one to become pregnant. It can cause bloating, nausea, diarrhea, or constipation, which can often be mistaken for inflammatory bowel syndrome. And it can also cause fatigue and or muscle weakness. The way we diagnose endometriosis is that we do a very thorough pelvic exam. The pelvic exam can allow us to feel if there's any cysts or scarring. It can also allow us to find out if the uterus is retroverted or what we call pulled down by the adhesions that are occurring in the pelvic area. We also use an ultrasound. This ultrasound can be used to look for signs of cyst formation as well. An MRI can also be ordered. The MRI, again, can show us if there's implants outside of the uterus. It can show us the size, and it can really help us to determine what sort of surgical procedure that woman needs. Now, a laparoscopy is a tool we also use to diagnose endometriosis. And what we do is we make a small incision near the navel, and we put what we call a laparoscope or a telescope inside of the pelvic area. And we look around, we take tissue biopsies, and we look for what we call a gunpowder. Endometriosis has a very distinguishable appearance when we look at the pelvis. It looks like gunpowder. It's dark black typically or brown in the pelvic area. So let's talk about some of the conventional treatment options that we typically use for endometriosis. It can involve medication or surgery. Typically, we start out with pain medication like non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, Advil, or we can use even stronger medications like opioids, like Norco. We have hormonal therapy. One of the first lines of hormones that we use are birth control pills. Birth control pills will help slow down the periods, which will help slow down the implants. We also can use GnRH or progesterone and even aromatase inhibitors. So those are really big words, but those are hormonal therapies that we can use to eliminate the pain of endometriosis. Again, conservative surgery includes a laparoscopy where we kind of burn the implants or remove the implants. For more severe cases of endometriosis, of course, would be a hysterectomy. So removing the ovaries, the tubes, and the uterus. Again, we wouldn't want to do that if a woman wants to have children. So the laparoscopic surgery would be for those women who want to conceive children who have endometriosis. And then there's some home remedies, warm baths, heating pads, and again, those over-the-counter pain medications. Some alternative medications include also acupuncture. Acupuncture has been used very successfully to provide some relief from pain. But CBD, of course, is another alternative option and showing a lot of promise to use in women who have endometriosis. And we'll talk about the anti-inflammatory properties that CBD has and the analgesic properties that CBD has to reduce pain. So what is CBD? CBD stands for cannabidiol. Cannabidiol is the second most common cannabinoid found in different strains of the cannabis plant. It's the most common cannabinoid found in the hemp plant. Unlike THC or delta 9 tetrahydrocannabinol, which gives us that high or euphoria, CBD has no mind altering effects. Now, when we look at the plant, the cannabis plant, it has two species. It has a marijuana species and it has a hemp species. We know that CBD can come from both the marijuana and the hemp species. The difference is that the marijuana species has a high THC level and a very low CBD level, and the hemp species has a very high CBD. And for all practical purposes, the definition of industrial hemp is containing less than 0.3% of THC. So you see the difference between marijuana hemp, and you also see that CBD can come from both species. Tonight, we're specifically talking about CBD being extracted and coming from the industrial hemp plant. Let's look at the other cannabinoids that the plant makes. There are other cannabinoids, but you see the main player, the hero is CBD. CBD has many, many medicinal properties. It's an antibacterial, it inhibits cancer cell growth, it promotes bone growth, it reduces seizures and convulsions. In fact, the media in 2013 really made CBD more of a topic when the little girl, Charlotte Fiji, was really helped by her seizure disorders with CBD. CBD also reduces blood sugar levels. It reduces the function in the immune system. So when those people who have and patients have autoimmune diseases, it's very helpful in lupus and fibromyalgia, scleroderma, to name a few. It reduces inflammation. CBD reduces the risk of arterial blockage. It also reduces small intestinal contractions. It helps to reduce vomiting and nausea in those who are undergoing chemotherapy, or even our moms that have nausea and vomiting in the first trimester, or even hyperemesis gravidarum. CBD relieves pain. It's a great analgesic. In fact, it's been used for over 5,000 years for pain relief. It also relieves anxiety, depression. It slows bacterial growth. It suppresses muscle spasms. You know, the uterus is a muscle. So that's why CBD is very helpful in those women, not only who have endometriosis, but who have menstrual cramps. CBD is tranquilizing. It treats skin disorders like psoriasis and eczema and acne. And CBD is also a vasorelaxant. Well, let's look at delta 9 THC or THC. It reduces vomiting and nausea, relieves pain, it stimulates the appetite, really important in those who have HIV or AIDS, or even undergoing chemotherapy whose appetites need stimulation. And it also suppresses muscle spasms again. The other cannabinoids that you should be aware of that also have medicinal properties are listed here: CBDA, CBG, CBGA, CBC, CBCA, and delta 8 THC, and my favorite, THCV. A lot of studies done on THCV and its role in weight loss. So you can see a full spectrum product is important to have the more potent effect on a cellular level. So, how does CBD and the other cannabinoids work? Well, they work by the endocannabinoid system. This system was discovered about 30 years ago when I was in medical school at Wayne State School of Medicine, and it was deemed the most vital regulatory system in our body. It actually modulates and regulates how we think, how we feel, how we react, our pain, inflammation, our anxiety level. And this system is made up of endogenous cannabinoids. Those are cannabinoids that our body produces. In fact, one of the cannabinoids, anandamide, is very, very prevalent and found in high amounts in breast milk. This system is also made up of receptors that are found not only in the brain and the central nervous system, also in the immune and the periphery, but these receptors are found in the reproductive organs. In fact, you'll see in a later slide that the uterus has the highest level of CB1 receptors that are looking for cannabinoids. These receptors are found in the lung, the vascular system, the liver, the colon, of course, the immune system, the spleen, the pancreas, the adrenals, the muscles, and bones. So these receptors are found throughout every organ and gland in our body. So CBD for endometriosis is currently being used to decrease the inflammation and to decrease the pain. Again, CBD interacts with the body's endocannabinoid system, CB1 and CB2, and these receptors are found in high levels in the uterus. And because CBD also decreases muscle contractions and spasms, remember the uterus is a muscle, so it is beneficial in helping to relax the muscle during inflammation and pain, and even during times of the menstrual cycle. So, again, this slide is very blurry, but I tried to make it as clear as possible. But the highest amount of CB1 receptors are found in the uterus. And again, the uterus is the organ where endometriosis is affected. So CBD also may be helpful, again, in reducing pain and inflammation. So let's move on to Wakana and about our company, because I really want you to know, if you're a guest on the line, about Wakana and who we are. Wakana was actually launched on April 20th of 2019. So we're just about 5 months old. And it was brought into existence through the synergistic efforts and shared foundational values of four African American women who believe that health, wealth, legacy, and freedom are gifts that belong to all people. Here are the four co-founders. Our CEO is Melissa Boston, and she brings over 30 years of experience in the home-based arena as well as in sales. She is a social media strategist. She has business in over 40 countries and has really trained and coached over 50,000 distributors. This is her vision. Wakana was given to her, the name, the vision. She is our visionary behind Wakana. Our president, Dr. Patricia Van Pelt, is a state senator. She's an evangelist, an entrepreneur. In fact, she's serving her third term here in Illinois. She has truly given us the pathway to ownership. There's an opportunity of you owning a part of Wakana. And our senior VP of sales, again, 30 years of experience in the service and sales industry. We call her our midwife, where she is able to birth opportunities that each and every one of us has in this cannabis arena. And then myself, Dr. Rita McGuire, I'm an obstetrician gynecologist. I am the chief medical officer for Wakana. I bring 3 years of experience in studying this plant, and I'm also very active with the medical marijuana and the adult use law that was just passed here in Illinois. So here is our product line. Our product line is a very professionally packaged. Our products are double certified and third party validated, which means before they even hit your shelf, they are tested to ensure that the product is free from mold, mildew, heavy metals, and pesticides. And the product contains the appropriate level of cannabinoids and the appropriate level of THC, which is 0.3% or less. Our farms are growing organically industrial hemp. Our farms are sourced from Oregon, Colorado, and Kentucky. And we also have a farm in Northern Europe that's been growing industrial hemp for over 100 years. We also have a pure line. Our power line, is the line that is in the black packaging or the black label. That is a full spectrum product, again, with the legal limit of 0.3% or less of THC. Full spectrum means that we use the whole plant. I showed you some of the cannabinoids that were listed there. Along with those cannabinoids, it includes terpenes, and terpenes are what gives the plant its aroma. Terpenes also have medicinal properties in helping to decrease inflammation and pain, as well as flavonoids. The combination of that full spectrum product on a cellular level gives you an amazing potency to those symptoms that you're trying to resolve. Now, our pure line is our broad spectrum line. That is the line that has the white label. That line contains less than 0.0% THC. A broad spectrum product contains all of the cannabinoids minus that THC. This is a great line for those who have random drug screens at their job. So we're going to go through some of these products, and then I'm going to highlight also some ways that you can use these products if you suffer from not only endometriosis, but maybe menstrual pain or menstrual pain during your menstrual cycle, couldn't get that out, right? Or any other entity of chronic pain and inflammation that we see in endometriosis. So we're going to go over the fact that our products are products you can trust. We use some of the most rich medicinal hemp products that are fully compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, as well as our products are Farm Bill compliant. And what that means is that the Farm Bill, which was passed in 2018 by President Trump, states that CBD, which is extracted from industrial hemp, is no longer a Schedule 1 drug. It is now descheduled, and that means that it can be sold, consumed, and even cultivated in all 50 states. So our first product that I want to talk about is our Power Extreme Relief. This is a great product that you can use topically if you have menstrual cramps and if you have pain due to endometriosis. This product can be used right in the area of the abdomen, in the pelvic area, to reduce inflammation and pain. This product contains 0.3% or less of THC. It's 200 milligrams of CBD in a 15 ml bottle. And we also have a proprietary blend of very powerful organic essential oils, which include arnica, black seed, turmeric, eucalyptus, clove, cinnamon, peppermint. All of these organic essential oils do what? They have an anti inflammatory property that enhance the anti inflammatory properties of CBD. So, a great product to use topically for inflammation and analgesic control. Our other power relief product is our 500 milligram product, which is in a 60 ml jar, again offering relief topically for those who have menstrual cramps or pain due to endometriosis. This is a great way, again, to apply CBD to get local relief from areas that cause discomfort. Now, our power product, our Power Hemp MD, is our most concentrated tincture. It is a 750 milligram in a 15 ml bottle. This is our most concentrated product. In fact, a lot of physician offices and pharmacies like this product because of its high potency. It comes in a tincture form, which means you can place it underneath the tongue and hold it for a minute before you swallow to ensure that this CBD is getting into the bloodstream. Again, this product is very unique. No other products in the marketplace has this proprietary formulation that includes black seed, turmeric, and peppermint. Again, these three certified organic essential oils do what? They have anti inflammatory properties that enhance the anti inflammatory properties of CBD. Now, the recommended dose for our Hempranium MD is 3 drops twice a day, which is our daily support. That will give you 15 milligrams of CBD, or 8 drops twice a day, which is our health support. That will give you 40 milligrams of CBD, or 15 drops twice a day. That's the maximum support that will give you 75 milligrams per day. So we're going to stop sharing the slides for a second. Give me 1 second so we can stop sharing, and we can take me off of video so we can continue with our product line. So we are going to continue with our power line. I always like to give a live demonstration. Our next product is and we see my doctor colleague in the background, right? Our next product is our Power Hempranium 500 milligrams. This 500 milligram is a less concentrated tincture than the Hempranium MD, but it still gives you those certified organic essential oils, black seed, peppermint, and turmeric, that also enhances the anti-inflammatory properties of CBD. Again, this tincture you're going to place underneath your tongue. You can start out with 3 drops in the morning or 3 drops twice a day. You can increase that to 6 drops twice a day, and the maximum support is 15 drops a day. That would give you a maximum dose of 50 milligrams on a daily dose. Now, what's interesting is that the Mayo Clinic did a study, and the study showed that most patients don't need a lot of CBD. Most patients need between 2.5 to 25 milligrams a day to address inflammation, pain, and any other symptoms that you may be addressing. So that's why I stress with my patients, start low, start slow, more is not better. Our next product that I want to talk about is our Power Gummies. Oh my goodness. Everyone loves gummies. Our gummies are a full spectrum product. Each gummy is 25 milligrams. Our gummies are not coated, but they're infused. When they're infused, that means that the CBD and the other cannabinoids are more potent because they are infused in the actual gummy. Our gummies are vegan, they're non GMO, and one gummy is enough to address the same things that we talked about that CBD can address, from antibacterial to anti anxiety to inflammation to analgesic pain control. Again, I love using these gummies with my patients at night because gummies take about 45 minutes to 90 minutes to get into the bloodstream. So that really allows time for you to take the gummy and to settle down at night to help with those symptoms that you are addressing. Now we have another product, which is our Power Water Soluble and our Power Culinary Plus. Our Power Culinary Plus